production, your hormones, food sensitivities or genetic food sensitivities. That is actually what can actually drive that whole autoimmune condition and make it much worse. And usually these autoimmune conditions are going to run with autoimmune anemias and also genetic sensitivity to gluten. So we'll actually want to do these specific tests to determine, you know, if you have these, so we can actually correct them and put you on the appropriate supplementation and diet, as well as work on your brain and your nervous system to actually drive it and make it healthier. So the critical areas that we'll actually look at is to determine if you're autoimmune. We'll determine, you know, do you have an anemia? Do you have blood sugar regulation problems using the adrenal stress index? Do you have any GI or liver problems? Any problems with fatty acid metabolism? And one of the tests the first test that we may run is to check the health of your gut. It's called the DNA stool profile. 20% of your thyroid hormone is actually absorbed in your gut. So if your gut is damaged, for example, you may not even have irritable bowel symptoms, but you can still have damage to your gut due to an amount of stress, such as an increased cortisol. It can affect your gut lining, which can cause an overgrowth of yeast, bacteria, parasites, and bugs, which need to be evaluated for. This can affect your chronic condition. So that DNA stool profile that I run actually checks specifically to see if you have the good beneficial bacteria that you need in order to have a healthy gut. Also to see if you have any pathogenic bacteria, so we can rid of that in order to help that person with the chronic condition function better, as well as absorb that thyroid hormone. Adrenal stress index. This is a salivary test to determine how much, if you're producing cortisol, as well as how is your circadian rhythm. Are you normal adrenal stress? A normal adrenal gland should produce cortisol in the morning, and that actually wakes your body up and allows you to get out of bed. Most of the people that have these chronic conditions, chronic fatigue, fibromyalgia, and thyroid conditions, are having great difficulty in the morning getting out of bed and being completely fatigued. That is a function of the adrenal glands. As we go throughout the day, in the evening, the adrenal glands or the cortisol level should come down so that we can actually sleep throughout the night and not have an insomnia or be an insomniac. For people that have chronic stress, chronic infections, chronic food sensitivities, the adrenals are going to be completely off kilter, and you'll have low cortisol in the morning and high cortisol at night, whereas you have much difficulty getting out of bed and then quite a bit of difficulty falling to sleep. So we run the adrenal stress index to determine how that is, and then work on correcting the health of those adrenals, as well as reducing the adrenal stresses, such as stress, foods, poor foods, caffeine, different stresses in the environment, as well as inflammation in the body, which can be an adrenal stressor. We also run the genetic gluten sensitivity test. This is going to tell me if you have a genetic sensitivity to gluten, which we find that this is a very common thing for people that have these chronic conditions, specifically chronic fatigue, fibromyalgia, and thyroid disorders. Genetic gluten sensitivity needs to be ruled out, because if you have it, every time you eat food such as wheat products, you're actually affecting your immune system. And this whole autoimmune cascade, like we talked about with Hashimoto's thyroiditis, which is an autoimmune condition. If you have a genetic sensitivity to food, this particular food, it can actually cause a whole autoimmune reaction and eventually not only attack your thyroid, but it can also attack your brain and your pancreas. So this is a huge problem that we have to get to the heart of, so that we can stop that whole cascade and prevent it from attacking your brain and causing brain damage, essentially. We also run a test called the intestinal permeability test. Basically, the health of your brain can be determined by the health of your gut. If you are not absorbing the foods appropriately, if you're eating the wrong foods, if you don't have the enough enzymes to digest your foods, you can have something called a leaky gut, whereas foods can leak in and out of your gut and cause, again, an autoimmune cascade or reaction. So we're getting all this inflammation and pain as well as brain fog as a result of damage to the gut. So we'll want to get to the bottom of that. We'll also want to examine you neurologically. So we'll want to check your balance, your ability to move in a coordinated fashion. We can actually check you neurologically. How, do you have any weaknesses in your eye movements, and your coordination, and your ability to smell, your ability to remember things? All of these things we can examine neurologically, and oftentimes it'll show up as balance problems. When we have a lot of autoimmune reactions in our body, we'll have poor balance, poor coordination, poor movement, a lot of fatigue, a lot of joint pain, and we won't be able to perform these simple examinations that we do to determine if someone has a brain imbalance or if someone has coordination problems, which we find that this happens with these autoimmune type of problems. The other thing that we will check in regards to blood panels is immune panels. If we suspect that someone has an autoimmune reaction or an autoimmune condition, which we know that a large amount of people with thyroid conditions do, we'll actually want to check the two legs of the immune system. We've got the Th1 and the Th2 pathway. The Th1 pathway is cell-mediated immunity, and this is the one that reacts immediately. We've also got the second leg, which makes antibodies. So what we'll want to do is actually run a panel to see which leg is working, which one isn't, or are both not working as well as they should. This is extremely important because, again, we've got to keep the immune system in check, give immune support for someone who has an autoimmune reaction against their thyroid or an autoimmune condition in general, such as MS, that type of thing. So we'll want to actually support the immune system with supplementation and dietary changes. If that immune system is not checked or kept into check, for example, for the autoimmune person who has an autoimmune reaction against their thyroid, who has a gluten sensitivity, if we do not get to the bottom of that, our body will continue to destroy itself. We will actually continue to make antibodies against our own tissues. And again, that if a thyroid can eventually be damaged, and it will then go for the pancreas, the myelin sheath in our brain, the cerebellum, which is the balance center of our brain, our joints, or our muscles. We can actually make antibodies against that, those areas which you would consider fibromyalgia or fibromyalgia, chronic fatigue type symptoms. So once we find out where those functional areas of problems are, once we run all our panels, we will then actually put someone on specific supplementation to correct those imbalances like I mentioned. So those functional blood sugar problems, adrenal problems, cortisol problems, thyroid problems, ruling out whether or not someone has an autoimmune reaction, and then we'll work to dampen that